Okay, welcome to chapter 4. Okay, this is our third meeting for developmental psychology. So today we're talking about chapter 4, or just prenatal development and birth. There's going to be a lot of information, but the lecture is being recorded. Okay, so we're going to talk about all of these things: prenatal development and birth. Basically, we'll start talking about the female menstrual cycle, basically the stages of prenatal development there. We'll talk about birth, teratogens, reflexes, many different things, family bonding, postpartum depression. We'll go through those things quickly, okay? So first, let's start with ovulation. If you are a female and you are of age, you've started ovulation, right? It starts at a certain time, right? Depending on who you are, it might have started when you were 12, 11, or even 10. Actually, it could start as early as 8 years of age or something. I mean, there are some extreme cases. We'll talk about those things at a later chapter, what can cause ovulation to start earlier. But today we're focusing on reproduction, so we're not going to talk about, what causes women to start ovulating sooner than others and all that stuff. So the female menstrual cycle, ovulation, okay? An ovum, think of it like a little egg that needs to be fertilized, right? Is released about every 28 days. We said last week that it contains half of the genetic information to make a human being, okay? So the ovum is basically produced by your ovaries, okay? Your ovaries, if you're a female. Ovum is singular, ova is plural. So ovaries produce ova, which means many ovums, okay? And the ovum will move through the fallopian tube, where it may be fertilized by a sperm, depending on whether you've had sex or not, depending on what happens. In the first 24 hours, it will move down and might encounter a sperm here and there, okay? The fertilized ovum is called a zygote. We mentioned the zygote last week, right? When the sperm and ovum basically combine their genetic material and give you this fertilized egg, you could say. It's called a zygote. Once you have a zygote, right, fertilization has occurred, the uterus will then prepare itself for conception, which means you will not get your period, okay? If the ovum is unfertilized, then it will be shed and expelled through the vagina when you get your period. All right? If you're a woman, you already know. Actually, even guys know that already. This is pretty much common knowledge, okay? So let's keep going and talk about these stages of prenatal development. So let's say fertilization has occurred and the uterus is preparing itself for conception. So basically what happens is you get that thick lining. There's a thick kind of fleshy lining that occurs along the uterus. And that's where the zygote eventually will attach itself, implant itself, and will lead to more development, okay? So let's talk about these stages of prenatal development. The germinal period, let's talk about the germinal period. That's the first 2 weeks, okay, following conception. The first 2 weeks, first 14 days. What happens is the zygote, right, it's been fertilized. The ovum has been fertilized by the sperm, and it's called the zygote. The zygote during those first 14 days will travel in the fallopian tube. Fallopian tube, you can see right there is that thing that looks like a tube. At the end there, we have the ovaries, and then it attaches to the uterus. So the fallopian tube, the zygote will float around there and eventually make its way down, enter the uterus, and about 10 days later, it will implant itself. It will attach itself to the uterus. It will attach itself to that fleshy tissue that's on the uterus. If it does not attach itself, then it will get, like I said, it will get shed, and along with all that fleshy tissue during your period, if you are a woman, okay? And that's why all that bloody stuff is, okay? Believe it or not, only about 40% of zygotes achieve this. Only about 40% of zygotes will achieve implantation. Most of them will not implant and will be shed during your period. And you won't even know that you could have been pregnant, okay? And you could have had a child. So already, right from the very beginning, the odds are against you. You guys are a miracle that you're even here. From the beginning, when fertilization occurs, 60% of them will not make it, will not implant themselves. And then from there, even more will not make it. So we'll talk about the odds as we move along. Once the zygote implants itself, it will begin rapid cell division. It'll go from one fertilized egg into hundreds. 1 to 2 to 4, 8, 16, hundreds, and then thousands, okay? And then even more, and then billions by the time you're born, okay? That this dividing zygote is called a blastocyst. A blastocyst, okay? That is just basically a zygote that is dividing. That's called the blastocyst. During that period of rapid cell division as well, you'll have complete cell separation that will lead to different layers being formed. Okay, not complete separation in which you get twins, but remember, different cells are developing. Okay, from 1 to 2 and stuff like that, and that will eventually lead to basically the differentiation of different tissues. Okay, this cell differentiation will lead at first to two different shells, you can say, right? The outer cells will become basically the placenta, which will nourish and protect the developing embryo, and then the inner cells will become the embryo. Okay, so first there is differentiation where two different layers differentiate, and then there'll be more differentiation later on of the embryo. So you see an image there that you can see what is happening. The image is kind of small, but remember, if you are on a device, right, you can zoom in. You can kind of pinch it and zoom in. And it is already available as a PowerPoint, and it will also be available as a lecture. Here's some larger images for you guys so you can see a little bit more what's going on. So you can see the zygote there, the first image right there on the left, and then you have cell division kind of occurring there. It turns into 2 and then 4, right, further along. And, you see further and further cell division as the zygote divides further. And you can see there at the end, the last image on the lower right, there comes a point in time when the zygote actually looks like the planet Earth. Interestingly enough, looks like a planet. Okay, let's move on. That was the germinal period. And it's called the germinal period because to germinate means to travel. The germinal period is when the zygote is traveling, it implants itself, and then differentiation occurs. And then you move into the embryonic period. Eventually, the embryo grows from those inner cells, from that inner layer. Okay? The embryonic period is the 3rd to 8th week, the period of the embryo. There's some important things I want you to know, and they are in bold. Everything's important, but the things that are in bold I'm more likely to ask you about. So 3rd to 8th week. So during the first 14 weeks, we have the germinal period. And after that 14th week, you have the embryonic period. The 22 days is important. Something important happens at 22 days. At 22 days, you have something called a neural tube that develops. It is basically a tube that developed that looks like a little worm, and that will become the central nervous system. Later on, that will become the brain and the spinal cord. In the upper region, which will be closer to the head, that's where the brain will develop, and then the spinal cord will develop below that, and it will all be connected, of course. By the 4th week, the embryo is about 1/8 of an inch. That is tiny, okay? But interestingly enough, the head, the eyes, the ear, the nose, and all those things are beginning to form already, and it's barely 1/8 of an inch. To me, one of the most incredible things that happens by the 4th week is that there's a tiny blood vessel that will begin at just the 4th week. Tiny blood vessel, okay? That tiny blood vessel later on will become the heart. So at just 4 weeks, you have the first sign of cardiovascular activity. There's a tiny blood vessel that is beating, and with very sensitive instruments, they can detect that. And you can see the image there of what it kind of looks like. Doesn't look human yet, doesn't look like much, but that's what it kind of looks like by about the 4th week. we enter then, actually the next slide here is still about the embryonic period. By the 5th week, still looks similar to the 4th week. By the 5th week, you see the image right there. That's kind of what the embryo looks like. By the 5th week, and even kind of during the 4th week a little bit, but a little bit more during the 5th week. The 5th week, you can see the little buds, okay, begin to appear. The little buds will be the arms and legs. So you can see little flaps there, kind of look like flippers, okay, or like oven mitts. That will become the arms and legs, okay? And there's a primitive tail that appears. Looks like a little tail there at the end, if you can see there. Toward the bottom, there's a little tail. What looks like a little tail. That will eventually disappear, okay? So by the 5th week, you can see these little buds that will become the arms and legs. 6th to 7th week, the embryo is about 2.5 centimeters, which is basically almost an inch or about an inch, okay? And you can see the picture there. The upper arms, okay? You can see the upper arms, the forearms, the palms, and webbed fingers appear. You can see that looks a little bit more like an arm, and a little bit more like a little leg there, but still too small, okay? But those appear. There's legs, feet, and there's webbed toes. The toes are kind of there, but they're webbed. Just like a duck, there's webbed toes. Now the embryo is developing in an aquatic environment, okay? So there's webbed toes, and eventually they will separate and you'll have normal toes. 52 to 54 days, fingers and toes separate. By that time, they will separate, okay? And you can see what the embryo looks like during that time. Moving on, I know this is a lot of information here, especially during the embryonic period. A lot of the important things are already happening during the embryonic period. This embryo is tiny, but a lot of important things already happening. By the 8th week, the embryo is about 1 inch, and that's close to 2.5 centimeters. 2.5 centimeters, 1 inch are almost exactly the same, but 1 inch by the 8th week. And the important thing, one very important thing about the 8th week that you might be asked about is by the 8th week, the embryo looks fully human. Okay, you can see that is a human being, okay? The arms, the legs, you can see, looks like a human being. Now the head is still too big, makes up, a big portion of the embryo. It's almost as big as the rest of the body. That is normal at the beginning, but you can see that is a human being. And here's another thing about the embryonic period. 20% of embryos are aborted spontaneously, okay? Think about it, only 40% were implanted. And of those 40%, then you lose another 20%. Okay, so, the odds are against you, like I said, for even being born, okay? We're already down to a minority here, okay? So 20% aborted, why? Sometimes those embryos are abnormal, okay? And the body rejects them. And other things, another reason why they could be aborted is due to stress or, difficult things that the mother may be experiencing. A lot of stress or even abuse or things like that. There's a lot of things that can cause that. But basically, the body rejects the embryo is what happens, and sometimes it's because, many times it's because it's abnormal, but sometimes, sadly enough, it's because of stress and other things that have gone wrong or other difficulties. Okay, and of course I do want to mention it's very traumatic for people to have a miscarriage. Okay, that's what it's called. You have a miscarriage, but depending on when it happens, it can be even more traumatic. Here it's only about an inch. Okay, if it happens later, I mean it's horrible. It's much worse. Okay. Here it's like the size, it's like, an inch, a little bit bigger than an aspirin or something like that. Okay. A little bit more information here. Growth that is occurring. Just want to mention growth occurs according to two different rules, two different principles. The cephalocaudal principle means that the head develops before the rest of the body. The head is more important. So you can see the head there is much larger than the other parts of the body. It's almost as big as the whole body, because the head, where the brain is very important. So it develops first, okay? That's the cephalocaudal principle. The brain is already developing. A lot of things already developing, also in the rest of the body. So the head is larger at the beginning, and as the rest of the body catches up, the body lengthens, and then the head won't be so large compared to the rest of the body. Also developed according to the proximal distal principle, or the proximal distal kind of rule, where the center of the body develops before the outer regions. So the center, the middle part of the brain, the middle part of the body with the internal organs, all that stuff, the brain, all the internal organs will develop more quickly. Will start developing before the other parts of the body. Your arms, your toes, and all that stuff, your hair, the rest of your skin, that is not as important and will develop later, okay? But the inner part of the body, the internal organs, the brain, all that stuff is developing very rapidly. And it's amazing how rapidly that happens. Okay, by the 3rd month, you enter the fetal period. And this is the 3rd kind of stage of prenatal development. We started with the germinal period, okay? Then the embryonic period, and now by the 3rd month, you enter the fetal period, okay? So, what happens during the fetal period? Mostly a lot of rapid growth in height and weight. Yes, the internal organs are still developing. The brain and all that stuff is still developing rapidly. But what's very notable here is that during the fetal period, you go from an embryo and then you have a fetus. The fetus grows very rapidly. Goes from being, very small to not much more than, an inch or so, and then a couple, an inch or so, to basically, or maybe a few inches, to basically, at birth, could be 18 inches, 19 inches, 21 inches, right? So there's very rapid growth in height and weight, extremely fast. Okay, so during the fetal period, you go from not showing much at all if you're pregnant to looking huge by the time you're about to give birth. I mean, the fetus really grows rapidly. So, and also gains a lot of weight, okay, from just, a few grams to pounds, okay? The sex organs appear during this time. You can determine the sex during the fetal period. And this happens by about the 9th week. By about the 9th week, the embryo, if it's XY, the Y portion of the Y gene, that's SRY. The sex determining region of the Y gene, that's what SRY stands for, will signal for the male sexual organs to begin developing. Like I said before, the Y turns you into a male. If you do not have a Y, this does not happen. If you have an X, then development continues normally. But if you have a Y, then something else happens, okay? The sex determining region of the Y gene sends a signal for this other organs to begin developing. And then what happens is what otherwise would have looked like a vagina ends up becoming a scrotum and a penis. But without that additional signal, without that Y gene, you'll be born with what looks more like a vagina, okay, rather than a penis and a scrotum, okay? And by about this time, you can kind of determine the, the sex of the child by about the 12th week. So during the fetal period, by about the 12th week, the genitals are fully formed and are sending hormones to the brain. And the brain will be affected by these sex hormones. Male and female brains are different, okay? And these hormones will cause neurological sex differences. Okay, but this happens by about the 12th week. The genitals are fully formed, and then they can do an ultrasound, and they can tell you, yeah, this is a boy or this is a girl. They don't always get it right, okay? By the end of the 3rd month, the fetus is 3 inches and 3 ounces, okay? So we went from a little bit more than an inch to about 3 inches, 3 ounces by the end of the 3rd month, just 1 month. Now that's not very rapid growth yet, but eventually we'll have basically 18, 19, 20, 21 inches, okay? Very rapid growth. And, could be 7, 8, 9, 10 pound, or who knows how many pounds that baby will be. So growth happens very rapidly. And here we have fetus during the 3rd month, image of a fetus. The middle 3 months, you don't have to worry about those images down there. They're kind of complicated. But what happens during the middle 3 months? The heartbeat is very strong by the middle 3 months. Okay. And the digestive system, the excretory systems are, they develop. Okay. Which means the ability of the fetus to kind of urinate and excrete things. That is happening, believe it or not. Those systems develop, and believe it or not, that there is going to be fetal urine in the amniotic sac. Okay. Fingers and toenails, teeth, and hair develop by the middle 3 months. Okay, all those things develop. Okay, and importantly, the brain increases sixfold. The brain increases sixfold. There's a lot of things happen in the brain during this time. So a lot of new neurons develop. That's called neurogenesis, and a lot of synapses develop, and that's called synaptogenesis. Synaptogenesis is basically the connections between neurons. Okay, a synapse, if you remember from Psych 101, if your teacher talked about that, or your professor talked about that, the synapse is the point of communication between neurons. It is the gap between one neuron and another. Okay, it is the point at which neurons communicate. So a bunch of neurons develop and a bunch of connections develop among those neurons. The brain increases sixfold. Okay, and these images down here, you don't have to worry about them so much, but I got them from a biopsychology class that I used to teach. I don't teach that anymore, physiological psychology, but sharing this image with you guys of the process basically of how one neuron kind of extends and grows and tries to make contact with another to form that synapse, to basically undergo what we call synaptogenesis. But you don't have to worry so much about that. If you know what the text says, that is fine. That's the middle 3 months. And here's an image, and you can see the development of the brain during the fetal period. You can see 25 days there. That still looks like a tube. The spinal cord brain still looks like a tube. Okay, and it's called the neural tube. And there's a few little lumps there, and then those will develop further into a brain, okay? What looks like more like a brain. By 60 days, that's the way the brain looks like. By 100 days, looks more like a brain there. And then we see by 20 weeks, 28 weeks, and then by 35 to 40 weeks, which is already considered full term, you can see that the brain has gotten a lot more wrinkled. The brain was smooth, and then it got gradually a little bit more wrinkled, and is wrinkled, very wrinkled by that time. And what's happening is that as the brain is as the brain is developing and getting bigger, it is taking up more space, and it is what it does so it can fit in the brain, the space available, is that it folds in on itself, basically to have more surface area available. Think of it this way. Think of a piece of paper, okay? And try to put that piece of paper into a little ball that you cut in half, okay? It won't fit if the piece of paper is extended, but if you get it and you crumple it up and you fold it in on itself, and then you can put it into a little ball. And that's kind of what's happening with the brain. It folds in on itself as it gets larger and therefore gets wrinkly. And that allows for more surface area and for more volume. Okay, the middle 3 months, some important things you need to know more about the middle 3 months. By 22 weeks, you have something called the age of viability. And what that means is that by 22 weeks, the fetus can survive outside the uterus, outside the womb, with special care, however. Respirators, heart regulators, the fetus will be very small, okay, won't weigh very much, and will need to be hooked up to respirators and heart regulators to keep the infant alive while it develops further. And a lot of them won't make it, okay? But it's possible for the newborn to survive should the newborn be born at that age. 22 weeks is very early, but the fetus can survive outside with special care, but the odds are against the fetus. Most likely the fetus will not make it, okay? The younger that you're born, and we'll talk about that, we'll talk about being born premature. The younger you're born, the more problems there's gonna be, the more likely you are not to survive. The key thing for survival is brain development. Is the brain is advanced enough the infant is more likely, the newborn is more likely to survive. About 5% of actually fetuses are aborted or are stillborn by the 22nd week. By the 22nd week, about 5% will be spontaneously aborted, or if they're born during that time, about 5% they'll be stillborn. They'll be basically they'll be born. You know, they won't be alive. They'll be dead basically. You know, yeah, if they're born during this time, chances are that they're not going to survive, and about 5% of them just won't be alive to begin with, right from the very beginning. By 22 weeks, by 26 weeks, I should say, the survival rate increases to about 50%. So 50-50, if they should be born by 50%, I mean, by 26 weeks, it's like flipping a coin, whether the infant, the newborn is going to survive or not. Okay? But if they are born, 14% of them will be severely impaired. Will have brain abnormalities, you know, and other problems, heart defects, lung problems, although, you know, a whole bunch of different problems could result. They'll be severely impaired, 14% of them. Most of them will not, but 14% of them will be severely impaired. About 12% of them will have cerebral palsy, basically damage to the right side of the brain that controls movement, and basically they'll have problems with movement. So you want to get further and further along so your infant is more likely to survive and more likely to be born normally. By 28 weeks, the infant weight, or the fetus, I should say, weighs about 3 pounds, and about 95% of them will survive if they are born by 28 weeks, okay? So just a few weeks can make a big difference in terms of survival. So you want to get as close as you can to full term, which we'll talk about is about 36 weeks, 35 weeks, 36 weeks, okay? And you can see here some infant there that was born premature, and a fetus, right? You know, during the middle 3 months. Okay, let's talk about the final 3 months. Final 3 months. During the final 3 months, there's a lot of growth and weight gain. Okay, during the final 3 months, the fetus gains about 4.5 pounds during the final 3 months. Think about that. Usually, that means that for most fetuses, that's most of the weight is gained during the final 3 months. And the average is about 7.5 pounds at birth. Now, of course, some infants can be much bigger than that, much heavier. You know, 10-pound baby is a big baby, but 9 pounds, 8 pounds, 7 pounds, 6 pounds, you know. Both my kids were around the 8-pound mark, okay, when they were born. But 7.5 pounds are normal, okay? But I've heard up to, you know, 13, 15-pound babies being born. I don't know what the record is, but I know they can be a lot heavier than that. But the average is about 7.5 pounds. And by the way, the infants, just because they weigh a certain amount, or your infant doesn't weigh that much, doesn't mean that that newborn isn't going to grow to be a humongous human being that will weigh a lot, okay? The weight at birth, and by the way, the length at birth doesn't determine how tall they're going to get or how much they're going to weigh down the road. I'll tell you a bit more about that later when we talk about height, okay? But I can tell you from weight that just because they're born and they don't weigh that much doesn't mean that there's not going to be a humongous human being that's going to weigh a lot, okay? Or maybe could be one that's not going to weigh very much and be small. The weight at birth doesn't tell you that. The weight gain ensures that developing brain is more nourished, is well nourished, okay? A lot of that weight gain is for that. It nourishes the brain. Malnutrition actually reduces the future ability of the newborn to learn. If you don't nourish yourself very well as the potential mother, you know, and your infant doesn't get enough nutrition, that will impair the development of the brain, and then your newborn basically will be impaired and will not be as smart as he or she could have been. Okay, malnutrition, we'll talk about that separately at some point, and it's a horrible thing. And we'll talk about malnutrition of infants, of newborns, but also malnutrition for the mother is not a very good thing. You need to make sure you're well nourished, okay? But it's not true that you're eating for two. It's not true that you have to eat twice as much because you're eating for two. You can eat the way you normally eat and you'll be fine. Just don't starve yourself, okay? To keep your figure or whatever it is, okay? You want to get adequate nutrition, but you don't need to eat double. That's not true. You do not need to eat more than you normally eat. Just do what your body asks you to do, basically. If you're hungry, you need to eat, okay? Most women will gain weight, some more than others. More about the final 3 months. The respiratory and cardiovascular systems mature during the final 3 months. That means that during the final 3 months, the lungs will develop, the respiratory system, the cardiovascular, the lungs will develop more fully, the heart, and basically there'll be improved blood flow throughout the body. And you want that. You want the newborn to be ready to live without any special care and without any being hooked up to any devices, okay? You want the lungs to function on their own, the heart to work on its own. You want them to be able to breathe on their own. So the lungs begin to expand and contract during the final 3 months and begin to work on their own, and they mature, and the valves of the heart as well. And that is critical to viability. That is critical to when the newborn is, emerges and is born, basically, that he or she will be able to survive on their own. They're ready to breathe, they're ready to survive. Let's keep going. Okay, that is, those are the prenatal stages of development. Now let's talk about birth, the actual birthing process itself, okay? So first of all, how do you know that you're about to give birth as a potential mother, okay? So here's the thing. There's a fetal brain hormone called oxytocin that prepares the fetal brain for delivery and starts labor. So the fetal brain basically releases something called oxytocin. Actually, it will prepare the brain for delivery and will start labor. And that will trigger labor. It will trigger the uterine contractions, the release of that hormone, okay? Well, tell the fetal brain it's time for you to be born, basically. And the position of the fetus will shift before labor starts. Usually it will shift, not always, and we'll talk about complications in a moment. But that will trigger uterine muscle contractions. Your muscles in your uterus will begin to contract. And it's like they want to start pushing. And that will start labor. And that can be very painful, okay? So you'll get these contractions. They can be very painful. At the beginning, they may not be that bad. They'll be weak and irregular. You'll feel a little something, and they'll kind of come and go, and it won't be that bad. And then eventually, they'll become very strong, very painful, and regular, which means they'll come up regularly. And they'll be less than 10 minutes apart. So at first, not very often, and they're very weak. And then they happen more often, less than 10 minutes apart, regular. That means they follow a predictable pattern, and they're very strong. They really hurt. Now, what I didn't know until my wife gave birth about these contractions, about what they mean by regular, it doesn't mean that they have to happen every 3 minutes or every 5 minutes or 7 minutes to be regular. Okay, it could be that. They could happen that regularly, but it could also be like this. It could be that you get one 3 minutes later, and then the next one is 7 minutes later, and then it's 3 minutes later, and then 7 minutes later. So there's kind of a repeating pattern, so to speak. And they come and go, and they're, and they're basically, you start to see, basically, it's a cycle, basically. There's a normal cycle, up and down a little bit, but they are regular, they become predictable. And then you know you need to go to the hospital, okay? And we're gonna talk about labor now. Labor has 3 stages, okay? The actually birthing process. And it's very simple. Stage 1 labor is called dilation. That's when the uterus expands. So the cervix basically expands about 4 inches so that the basically newborn can fit through the birth canal. I know it seems like, when you look at yourself now, that seems like, a newborn can never fit through there. But things will happen to make sure that, that is possible. The uterus, the cervix will expand about 4 inches. Okay, so that head can fit through there. And even then, it still may not be possible. It might be very hard. It's not hard for every mother giving birth, but for some, it still may not be possible. Okay, and we'll talk about complications in a moment. Stage 2 is called expulsion. The uterine contractions basically drive the fetus through the birth canal. And that's what the contractions are, right? The muscles are expanding and contraction and are trying to push that fetus out. And of course, you have to try to, and you have to try to push. You have to push and tighten, you know, your uterus there, tighten your, you know, kind of, it's like trying to tighten your muscles or something like that, you know, your abdomen, your stomach muscles, but you have to, you know, tighten up and you have to try to push, okay? I know this is kind of, but women have described it as, you know, as trying to, you know, to basically, you know, go to the bathroom or take a dump or something. You have to try to push, okay? And my sister said that when you know the baby's gonna be born, you feel like you need to go to the bathroom, like you have to go really bad, she said. That's what it felt like something's about to come out of you, something really big, okay? Something interesting that happens worth noting during stage 2 expulsion is something known as crowning, okay? Crowning is the appearance of the head of the baby. You know, you can see the head of the baby, you know, with the vagina there kind of open, the birth canal kind of open there, and it's like the lips of the vagina form a crown on the baby's head. So they call that crowning, okay? And then you get expulsion, where basically the baby, the newborn, is driven out. The average, and this may have changed a little bit over the years, but it's the average is about 12 hours, okay, for newborn, for new mothers, I should say, about 12 hours of labor. For repeat moms, it's about 7 hours, okay? So it's a little bit easier if you've had one before. It doesn't take as long, but still, it can take a lot longer than that. It can take 24 hours, 20 hours, okay? It can take as little as 1 hour, okay? It all depends on the person. For some women, it's very difficult and they have to push and push and push. And for others, it's very easy for some reason. It doesn't hurt that much. There are, of course, you know, pain medication, things like that, that we'll talk about in a little bit. But do you want the birth to occur naturally, where you want to push through, and then there'll be hours and hours of labor, and sometimes a whole lot, you know, and for repeat moms, not as much, or for some, it might be easy, right? But there are ways to quicken this and make it easier, okay? Stage 3, the afterbirth is expelled. The placenta is expelled, so there's, you know, that comes out, and that only lasts a few minutes. And by the way, I don't know if the link is here, or maybe it's coming up. There is a video link, so you can see the birthing process. And it is a YouTube video. You wouldn't think you can see such kind of videos on YouTube, but you have to verify your age. And I think to verify your age basically means you have to log in. And for me, that's what I do. I log in, and then we can see the video. We won't have time to show it during class. Or you know what? I don't know, maybe. I'll leave it to the end, and we'll see if we have time. I don't know if you actually want to see it on your device, you know, or you want to look at it at your own afterward. But here's some images, right, of the birthing process. Not too shocking, right, because it's just some images. And you can see internally what's kind of happening there. Now, if you've seen it live, it is very, very shocking when you first see it, okay? Or even if you see a video of it, it is shocking, okay? If you've never seen it. You can't believe that that's possible, that it's happening. It looks bloody, it's painful, it is, it doesn't look very good, okay? It's just, it's shocking the first time. And then as you see it more and more, then it looks normal and it's not a big deal, okay? But here's some newborns over here. Like I said, it's very messy at the beginning. I mean, when you see newborn babies, you know, they look all cute and stuff in their pictures. They're not born that way, okay? They come out all slimy and bloody and covered in this thing called
okay,
By the way, you should not be talking right now. Please have your mics off, okay? Have your mics off, okay? I'm recording this. So they come out all slimy and bloody and stuff like that, and they don't look that way. But then they clean them up a little bit, and then they give them to you as the mother, right? And you get to hold your newborn, and they look better and better as the hours progress. Let's keep going. Let's talk now. Speaking of birth, how do you know if your infant is doing well or not? So there's this thing called the APGAR scale that we need to talk about that is kind of an assessment to determine how well your newborn is doing. So an APGAR scale, it's measurements that they take, a certain assessment that they do 1 and 5 minutes after birth. They can even do it even after that, longer, depending on how complicated the birth was and how well the infant is doing. They can do it late, even later, okay? But it's usually done at least 1 minute before birth and 5 minutes after birth, where they assess the baby. They see how the baby's doing. And it's basically, they use a scale from 0 to 2. 0 means if your infant gets a 0, that means there's severe problems. 1 means that, you know, it's not perfect, but, you know, there are some issues, but it's not the end of the world. And 2 means that there are no problems, that everything's fine, okay? And they check these 5 different things on this scale of 0 to 2. They check the appearance. What does the baby look like? Okay, does the baby look, you know, is the color good? Is nice and rosy in appearance, right? Or is the baby look kind of gray, kind of bluish? You know, that indicates there's some problems, okay? The pulse, is there a strong pulse? You know, no problems, right? Is there no pulse or a weak pulse, right? Grimace has to do with reflex irritability. Grimace is basically the expression on the child's face. You know, there should be some kind of grimace of displeasure. It is very difficult for, you know, the birthing process is kind of difficult, and the child usually looks annoyed. They have this look of irritation on their face, or they're crying or things like that. That's a good thing. If there's no expression on the child's face, that is a bad thing. That's a 0. It usually indicates something very bad, okay? Activity, how active is the child? You want the child, you know, basically to be, you know, those muscles are flexed and the child is active. You know that child is alive, okay? The muscles are flexed and there's movement, okay? If there's no movement, limp, no activity, muscles all flaccid instead of that, that's bad, okay? Respiration, right? The breathing, they'll check the breathing. Is breathing good, or is breathing weak, or is it absent? All those things, they look at all those things. And if you add up the scores from 0 to 2 for each one of those, there's a maximum of 10 points that your infant can get. 7 to 10 points is normal. 4 to 7 points means that there are some issues and the infant requires some intervention. So they'll do some additional things before they maybe hand off the child to you. Total score of 3 or less, that means the baby is in critical condition, okay? And, you know, they have to do some severe interventions. Here's the APGAR scale in a chart, so you can see it, maybe understand it a little bit better so you can see. So appearance, right? 0 points for blue, gray, or pale. 1 point for normal, except the extremities. Your child can look normal, but maybe the tips of their fingers can be a little bit blue, a little bit off in their color. You know, that's okay. They get 1 point for that. 2 points, normal color over the entire body. Basically, you know, usually some kind of pinkish kind of color. You know, they have, that means they're good. There's good blood flow. Pulse, okay. Pulse is absent, 0 points for that, okay. Below 100 beats per minute, they get 1 point. Above 100, 2 points. Grimace, okay. No response, no expression in the child's face, the newborn face. Very bad, 0 points. There's some kind of grimace, some look of displeasure. That's good, that's 1 point. If they're sneezing, coughing, crying, right? You know, that means they get 2 points. That's really good, okay? Especially if they're crying. That means they can breathe and they're crying and all that stuff. Activity, that's muscle tone, okay? Flaccid or limp, like a, you know, a piece of spaghetti or something like that. Cooked spaghetti, right? That's bad. The child is limp, probably lifeless, okay? Not good, 0 points, okay? And they have to try to kind of revive the child or something like that. And often they're unsuccessful. Or maybe the child has some activity, right? Kind of a bit weak, muscles are a little bit weak, but the child is inactive. There is some activity, but not much, okay? They get 1 point for that. Strong and active, the muscles are flexed, okay? You can see that the muscles are kind of flexed in the child and is moving. Let me show you this picture over here so you don't understand what I mean. Look at this child over here on the right. That picture doesn't look very good, but look at the hands, okay? And the muscles kind of flexed there, right? That is good. That's 2 points there. A little bit less severe and a little bit less kind of activity in the other one, less muscle tone, but still good. Respiration, if it's absent, no breathing, right? That's bad, 0. Slow, irregular is what that says. Got cut off a little bit, 1 point. Good. Crying, right? Strong breathing, that's good. And that is the APGAR scale. okay? And they do those assessments at 1 and 5 minutes. If the child isn't doing very well, then there'll be some intervention, and they'll keep checking the child even longer after that. And hopefully things go well. And they, you know, even when there are some problems, you know, where your child is born somewhere in the middle or maybe in critical condition, that doesn't mean that they won't make it. Often they do, especially if they're in the middle range. They'll get better usually later on. But if they're in that critical range, then, you know, there's a big worry there, you know, and there's more of a big worry. And, you know, the attempts to make sure the child survives are not always successful. Complications. Children can be born different ways. Normally it's head first, but there are complications. They breach birth. Birth is if the child is born feet first, which does happen, or buttocks first, or they try to come out sideways. All those can be complications and very difficult birthing processes, okay? More difficult for the mother. They might have to do a C-section if it's really bad, if the child cannot be born, or then, you know, child is trying to squeeze through and can't, the child is sideways, or trying to come out buttocks first, that probably is not gonna work. Children can be born feet first, but, you know, they might have to do a C-section, which means that they cut you open. They'll cut open your abdomen and remove the newborn, okay? Remove the child, okay? About a third of the times, that's what they do in the US. About a third of the time, the births happen through C-sections. Less in poorer countries. That's better for the newborn, less trauma, not as difficult for the newborn to be born that way, right? But for the mother, it's worse. Slower recovery for the mother. They cut you open, okay? And then they have to sew you back up, and you're gonna be in pain for a while. Slower recovery. It's gonna be harder for you to walk, harder for you to hold that newborn, right? Because it's gonna be, your muscles are gonna be basically cut. So longer recovery, okay? Other complications, there are many, these are just a few, okay? Cerebral palsy is when damage occurs to the motor cortex, of the brain. The motor cortex is actually on both sides of the brain, could be on the right or the left. And the way that works is the right side of the brain, the right side of the motor cortex controls the left side of the body. And the left side of the motor cortex controls the right side of the body. So I misspoke earlier when I said it's only on the right. No, it could be on either side, the damage to the brain, okay? The motor cortex is on both sides, okay? That controls movement. So if there's damage to the motor cortex, your child will be born with cerebral palsy, which means that your child will have difficulty with movement. As they get older and there's that damage to the brain, they'll have difficulty walking. And even when they do walk and all that stuff, and they try to wave their arms or point, the movement will be very kind of jerky, and it'll be hard for them to control. And if you've ever seen somebody with cerebral palsy, how they walk and how they move their arms, you'll know, you know, what this looks like. A lot of you are familiar with this, know what this is, but that's what it's caused. It's caused by brain damage to the motor cortex of the brain. Often due to anoxia, lack of oxygen to the brain can cause that brain damage, which can result in cerebral palsy, but it can also be due to other things as well. But often the cause is lack of oxygen to the brain. Or if your mother smoked, for instance, that could cause damage to the brain, and even prevent oxygen to the brain as well. Let's keep going, and let's talk now about other things that have to do with birthing complications, like being low birth weight. Okay, low birth weight, not a good thing, but the more severe the low birth weight, the worse it is, okay? The worse the chances of survival. So less than 2,500 grams, less than about 5.5 pounds at birth is considered low birth weight, okay? And when there is low birth weight, there can be more complications. There can be more problems down the road. There may not be any problems, but there often could be, okay? In the United States, right, there's been a steady increase in low birth weight over the past 25 years. And that could be due to a number of different things. It could be due to more drug use or alcohol use, or different things, you know, teratogens, which we'll talk about those things, okay? 8% of newborns are seriously underweight in the US. They're born seriously underweight, okay? Born low birth weight, okay? At least 2,500 grams or less, okay? Those that are low birth weight are more susceptible to teratogens, which we'll talk about in a moment. those are things that can cause basically problems for the newborn, that can lead to defects, problems, impairments, all sorts of things. They have higher birth risks, okay, as well, lower survival rate. Very low birth weight, okay, is under 1,500 grams, under 3 pounds, 5 ounces at birth, okay? Even more chances that there's going to be problems. Extremely low birth weight, under 1,000 grams, under 2 pounds, 3 ounces at birth. Really bad thing, okay? The infant may not survive. The chances of survival are always much lower the less the weight. You want to be close to 7.5 pounds. 6 pounds is fine, you know, but 5.5 pounds or less is low birth weight. If your child is preterm, that means they were born too soon. It doesn't necessarily mean that they're low birth weight, but it means they were born too soon. They may or may not be low birth weight. They may be normal weight, but were born early. But most likely the case is that if they're born early, they are also often low birth weight. So you want your child to be as close to full term as possible. So children that are born 35 weeks or earlier are considered preterm. 35 weeks is barely preterm. Most likely okay. Most likely everything will be okay. But the earlier they're born, the more chances there are that there'll be complications, that the child may not survive, that may have problems or defects or, you know, things like that. Okay, you can see the image over here of this preterm baby, very small there, very small baby. Actually, that baby is small for gestational age. Small for gestational age is not the same thing as preterm. Small for gestational age mean that given the term of the infant, right, given the term at which they were born, given when they were born, they are too small. Okay, they should have been bigger. They should have weighed more. It may be due to mental illness. Okay, there could be something wrong with the infant. Okay, or it could be due to drugs. The mother was on drugs and didn't take care of herself, and that impaired the delivery of the nutrition and the blood and oxygen, all that stuff, the blood flow to the developing embryo and fetus, and you know, and development did not occur naturally. Okay, or you know, it could be due to poor maternal nutrition. Okay, the mother's trying too hard to maintain her weight. She doesn't eat well. You know, you should eat when you're hungry, especially if you're a mother. Okay, you can be active, you can exercise up until late in pregnancy. Okay, if you're worried about gaining weight, but you need to make sure that you eat properly. And I'm not saying a bunch of junk food, although you will have cravings for that. But you know, you need to make sure you get proper nutrition. Teratogens are problems that can occur, that can cause birth abnormalities. And here are just some. There's many, many of them. Okay, hundreds. Okay, maybe thousands. Rubella, which is called German measles. If you get that, you know, while you're pregnant, and you know, that can cause problems for the developing fetus, can lead to heart disorders, cataracts, deafness, cognitive deficits, depending on when it occurs. Okay, HIV, the human immunodeficiency virus, right, can impair the immune system, slow the growth of the embryo and the fetus, right? That might, and also can lead to the child being born with a small head. That's called microcephaly. Babies that are infected with HIV, you know, can die by age 5, will die by age 5. But there's only a 25% chance that the mother will pass on HIV to the baby, even without treatment. With treatment, of course, the chances are a lot less. So you have to make sure that you are checked for all those things. And if you do have it, you need to make sure all that is known, okay? Because there's a 25% chance that you can pass that on to the baby, right? And if you do, there will be some severe problems. Your baby will be born with a compromised immune system, will be small, slow. The head will be small. And trust me, your baby will not look normal. Look up microcephaly if you want. I didn't put an image here, but it is shocking when you see that. It's like the top part of the head did not develop. They look very abnormal. It's a very sad thing. Toxoplasmosis is a bacteria that can cause brain damage, loss of vision, cognitive deficits, which means that your children's ability to learn will be impaired. Toxoplasmosis is found in cat feces, by the way. That's one place it's found. If you're pregnant as a mother, be very careful if you're cleaning the cat litter, or I would suggest that somebody else do it if you have a cat. Doesn't mean you should throw the cat out, but just make sure you do not expose yourself to cat feces, okay? That can have toxoplasmosis. Thalidomide is a chemical that used to be used in fertilizers that's now illegal to use. They used to spray it on crops, and then babies started being born with deformed limbs, with short, stubby arms and legs. That's what thalidomide causes. Malnutrition can impair cognitive abilities, lead to, of course, delayed small growth and all that stuff, right? Tobacco can cause low birth weight, respiratory problems, okay, all sorts of things. My wife actually has very slight cerebral palsy, and the most likely reason for that is her mother didn't stop smoking when she was pregnant. And my wife has very slight cerebral palsy, but other than that, she's mostly okay. It's slight, she's not severe. Another big problem that can be caused by teratogen, alcohol is a teratogen. Alcohol can cause something known as fetal alcohol syndrome, and the severity can vary. The condition is caused by consumption of alcohol during pregnancy. Consumption, by the way, by the mother, not the father. The mother's the only one attached to the fetus, okay, or the embryo. It can lead to slow growth, okay, and your child might be born, basically more, small for gestational age or premature. And when your child is born, the child could have abnormal facial features, brain damage that can lead to cognitive deficits, learning problems down the road. Your child will not be normal intelligence. But it depends on the severity of fetal alcohol syndrome. There's some people who have fetal alcohol syndrome, but a very minor form of it, and they look otherwise normal and are normal. But if it's more severe, the children can look like this, right? You can see the elongated hair there, thin upper lip, more space between the nose and the upper lip. The child looks abnormal and is small, and they will not be normal intelligence. And there can be even more severe cases than this, where the children will be born just severely abnormal and actually born lifeless. Okay, alcohol is a very bad thing. You want to avoid it while you're pregnant. One drink probably won't cause any harm, but you shouldn't drink at all. Okay, that's fetal alcohol syndrome. The severity, as with many things, can vary. Let's talk about reflexes. There's a lot of things that have to do with birth and, and giving birth. There's a lot of reflexes that the child is born with that actually aid in survival. And these first that I'm mentioning here are very important for survival. So the children are born being able to maintain oxygen, their oxygen supply. So there's reflexes like breathing is a reflex, for instance. Hiccups, getting hiccups, sneezing, thrashing, all those things are important for them to be able to breathe properly. So they can do all those things from the very beginning if they're normal, okay? They also have reflexes that maintain body temperature. They can cry, of course, and, tells you that they might be cold, so you can bundle them up. They shiver, that helps the body warm up. They tuck in their legs. They push you away with their little arms. They can push you away if they're too warm, okay? And all that helps maintain body temperature. There are reflexes to manage feeding, sucking, basically. They're born ready to breastfeed. Actually, it takes them a little while to get it. It depends on the newborn, actually. My daughter, when it came to breastfeeding, she got it within seconds, okay? Put the child near the breast, and they'll start suckling, most of them, right? And some of them get it immediately, within seconds. Some of them could take them a few minutes. My son took him a few minutes to kind of get it. But then again, my son is on the autism spectrum. So he's delayed when it comes to many different things. And that was a clue right there from the very beginning. Swallowing, they're born being able to swallow, to get that, swallow the breast milk. Rooting is a reflex that if you touch their cheek, whatever side of the cheek you touch, so you touch them on the right side of their cheek, they will turn in that direction. If you touch the left side of their cheek, the left cheek, they'll turn to the left. And that is important for breastfeeding. When they feel the nipple on one side, they'll turn to that side, try to latch onto the nipple. Or if they feel on the other side, they'll latch onto that, they'll try to get that other nipple, okay? And spitting up is also a reflex. If they should get too much too quickly, they can spit up. Children spit up very easily. It's actually a very annoying thing, okay? Newborns and even young children throw up very easily if you overfeed them or if they eat too quickly. And there's gonna be a lot of messes. Other reflexes, There's a bunch of them. The Brazelton Neonatal Behavioral Assessment Scale records about 46 different behaviors, including about 20 reflexes. And here are some of them, okay? The Babinski reflex is a reflex that when you stroke the foot of a newborn, their toes will fan upward. That reflex goes away over time. Now, if they stroke your feet, your toes will not fan upward. Unless, I've read that if you have cerebral palsy and you stroke somebody's feet, their toes will still fan like that. A stepping reflex. Children have a stepping reflex. Newborns have a stepping reflex. They can't walk, but if you hold them upright with their feet touching the ground on the flat surface, they'll move their little legs as if they're trying to walk. There's a swimming reflex. When you lay them horizontally on their stomachs, they'll stretch out their arms and legs as if, you know, they want to try to swim. There's a palmar grasping reflex. Put your finger on their little palms and they will grip it tightly. How tightly? Enough that you can kind of hold them up like this. Let's look at this picture over here. That middle picture right there, see? Demonstrating the grasping reflex. Just make sure you're careful, right? That if they do fall back, they're not gonna fall over and hurt themselves. Do it on a crib or something like that, or on a bed, right? Make sure they're safe. The moral reflex is when someone startles them, the infants will fling their arms outward and then bring them together when they're startled. Let's talk about family bonding just a little bit. We'll talk a lot about family bonding as we continue when we talk about relationships and attachment and things like that. But just a little bit here about family bonding. Bonding involves a strong, loving connection that forms as parents hold, examine, and feed their newborn. It happens many different ways, right? You breastfeed them as a mother. You form a very strong bond with your children. More strong than the bond that the father will form usually, because you breastfeed them. And there's that skin-to-skin contact is very important, okay? So it's recommended that you do something called kangaroo care, where you can rest your baby on your bare chest. You have that skin-to-skin contact. It's even more comforting for the child and also for you, okay? It's not essential, but it is helpful, right, for bonding. It does help with the bonding. But, you know, whether you bottle feed your child or you're holding your child, playing with them, all that will help bonding, okay? And the child will bond with you very strongly, especially if you are the mother. But it's not all good news, okay? It's very difficult to raise a newborn. We'll talk about those things when we get to the other chapters. When we talk about sleep and we talk about feeding and all that stuff, it's actually very, very hard, okay? There's something known as postpartum depression that I want to mention. Something that happens to about 8 to 15% of new mothers can get postpartum depression. They get very depressed after giving birth, okay? Symptoms can vary. For some, it's just the baby blues. They just feel a little bit sad and things like that. That the baby's no longer inside them and they feel a little bit sad. Or it can be, you know, as severe as postpartum psychosis, where some mothers can be so depressed and so feel so awful that they have thoughts of ending, you know, their own lives, ending the lives of the newborn, okay? All, you know, things like that, which is really bad, okay? So it can vary. It's a real thing, postpartum depression. And by the way, a lot of things can exacerbate this or maybe make it better. But baby care feels very burdensome. It's really bad at the beginning. It gets better, but it's really difficult at the beginning. And there might be thoughts of mistreating the infant that may exist. That can be part of postpartum depression. But yes, it's very, very hard to feed. You have to feed that newborn around the clock. And they don't sleep very well at the beginning, okay? It's really hard. It's good that the husband can help out, okay? If they can help out and they help you have some time off and bottle feed and all that stuff, okay? But you as the mother breastfeeding, you're the one who's gonna have most of the burden. Parental involvement can have beneficial, okay? Fathers can be depressed themselves, you know, it can happen more often with the mother, but fathers should be involved and help out, okay? Or even the extended family, or even older children if you have them. Causes of postpartum depression can vary, can be hormonal. Some people are genetically more prone to depression than others. It could be other things you know, that are environmental situations that may be happening, but it is a real thing, and it's a very dangerous thing. And if you think you have it, you need to seek help, okay, for the good of yourself and also the infant. And I believe that's it. I'm going to stop recording